So what we've done here for Lorraine is bring her in. She's just had the first part of a sedation, and we're just allowing her now to relax. And whilst she's relaxing and letting the sedation take effect, I'm just going to give her a little bit of a examination and palpation over her head. So the head is an immense structure. It's quite a complicated structure. It's got a whole series of sinuses and sinus chambers, air chambers here within the head. And a lot of those can be interrelated to the teeth, particularly the back 3 to 4 cheek teeth. Some of the root system is actually located very close to those sinus chambers, and so therefore if you do have any dental disease, it can, if the root or the apices of the tooth becomes affected, it can actually communicate and involve the sinus, and horses can get a sinusitis, which often shows up as a discharge from the nostril. So people wonder why they have this discharge, and we should never rule out dental disease as being one of the possibilities for causing that due to its involvement with the sinuses. So I make that initial assessment. I'm just putting my hands all over her head, palpating through the bony structures of the head, then the muscle and soft tissue structures of the head. We're very fortunate, just like ourselves, the horse is a mirror image. Down the midline, everything on this side should be exactly the same as everything on the other side, so the left and right side. So if one feels a bump on one side, you can simply go over to the other side of your horse and palpate or touch on that side, and if it's there as well, it's most likely a normal structure. Same as ourselves, so we're a mirror image. So I go over and feel, palpate through. These are the TMJs, the temporomandibular joints, which is basically the articulation of the top and bottom jaw. And we have two as well, just like a horse. So just palpating through for any swelling, any potential arthritic change that may show up as a bony, hard swelling, or even a fluidy swelling here that may actually be the joint fluid swollen. So just checking that as part of the process. So now she's starting to get nice and sedate, and I'm just checking those through, and then I'm going to go all across the large big bone of the lower jaw, this ramus here. And this big muscle here, the masseter muscle, big chewing muscle. So we feel all through there to see if there's any difference on either side, if there's any muscle wastage, which is atrophy, or muscle hypertrophy, build-up, which would suggest he's chewing on one side and not the other. We also go up to the top of the head, palpate through these temporal muscles here as well. Just having a little palpation here, just checking everything's normal. Now, of course, you know, as part of a all-over health check, being a veterinarian, we also we don't exclude anything. We check the eyes, looking for any discharge. We can also check for any disease processes around the eyes at the same time. So it's a really good opportunity while the horse is sedate to do these type of examinations, preferably not in the direct sun. Under shade is better. Okay, so I'm just going through, feeling under now the jaw. This is where the lower, on the mandible, the lower cheek teeth will sit here. In a young horse, you can get these dental bumps or eruption cysts, and we can palpate through, touch and feel on both sides. Now she's a mature horse, so hopefully she doesn't have any dental bumps or eruption cysts, because all her teeth will be in full wear. But if we feel a lump on one side compared to the other, then we should go and check why there is a lump there. Now, the horse has an awful lot of sensation, sensory endings all around the muzzle and the gum and the teeth. This is a very sensitive area of the mouth. You can see just by touching, she's already been stimulated. The nerves that involve just sensation to touch are very large in the horse. The infraorbital nerves that come out either side about here can be, in some big horses, nearly the width of my little finger, and in others just a little bit smaller, but it's still a huge nerve, purely responsible for pain, sensation. So that tells you, it's very important, you know, they're touching, feeling and grazing. So that's why, again, we stress dental pain is there and present. However, the horse has evolved to not show pain in the wild. It's stoic, so therefore it's very hard to gauge if a horse is in pain because of its teeth. It may show some subtle changes under saddle. And that's what horse owners alert us to when they're riding their horse. So you can see she's just moving a little bit as I touch and feel. So we've got the incisors, the front teeth, and then you've got this normal gap here, large area where the bit will sit, and there's no teeth present here. Teeth present are the tushes, or the wolf teeth as they're called, the canine teeth. And mares shouldn't really have that tooth. It's usually a fighting tooth, so stallions and geldings have them, but still about 20% of mares will have a canine. And this is actually a very good example. Looks like Lorraine has got the remnants of a canine tooth there. See, that tooth there is most likely to be a small canine tooth, a bridle tooth. Now in that position it's probably not causing any problems for her and the bit. The bit shouldn't be sitting there, so there's no inflammation around that, so we'll just leave that alone. Now she's going to need a second sedation. She's only just starting to take the effect of the first one. It is a two-part sedation, and that's going to be the next thing. So I've had a good feel around. We can percuss her sinuses. Looking for any dull sound. That's more important if we feel there's a swelling or we've got a nasal discharge, but it is part of a clinical examination. When we have some suspicion we may have sinus involvement, we will do that more thoroughly. These are the commissures, French for lip, the junction of the top and bottom lip, and that's where your bit sits. Now it's very important to check that. We're looking for any evidence of trauma, bruising, pinching of the bit. And so it's a very good area, and as owners you can always check this after you've ridden your horse. Hose the mouth out to get rid of all of the salivation, the foaming, which you can see we'll get this cleaner before we do the full examination. But then you can actually have a little look at this junction and see, has there been any trauma, has there been any splits to the lip or any rub mark or a sign of a pinching action, so a bruising. They're very tough structure, the commissure, but very important to alert you to either ill-fitting bits or that she is very hard at the contact because of other dental disease or dental pain. So they may grab the bit to avoid pain, or they may be reluctant to move on one side. And I always get that history from owners about, is there any resistance on the left or right rein? Are they leaning on one particular rein, which could alert us again to an issue on one or other side of the mouth. Okay, so that's the first part done.